Welcome to the Resilience series. I'm Stephanie Weaver, the author of the Migraine Relief Plan and the upcoming Migraine Relief Plan Cookbook. And for that project, I'm interviewing a variety of experts on the topic of resilience. My guest today is Dr. Stewart Tepper. Dr. Tepper is a professor of neurology at the Geisel School of Medicine at Dartmouth, director of the Dartmouth Headache Center, and a board member at large of the American Headache Society, where I've seen him present many times. Welcome, Dr. Tepper.
Thank you. Good to be here.
Explain to us the concept of neuromodulation. It's a big word. What is it, and how is it malfunctioning in people who experience migraine attacks?
It's actually a very exciting area for headache therapy. We have a lot of patients, there are a lot of people who do not respond well to medications. Either the medicines that are selected are incorrect targets, because when we use medicines, we're aiming at particular chemicals, and that may not be the chemical that is in play for a particular person's migraine, or a person may have side effects that make the medicines intolerable, or safety issues with respect to medications, or a preference for non-medication therapies, or they may be trying to get pregnant. And in all of those situations, a non-drug therapy is in order. And obviously, we are interested in behavioral modification and dietary modification, but sometimes additional treatments are necessary. And neuromodulation is a concept in which devices are used to go to, and various kinds of energy can be used, electrical or magnetic, to go into the brain and change the way the pain is perceived in the headache. And neuromodulation devices can be acute, that is, a person can turn it on just to stop a particular headache attack, or they can be preventive and use them every day to prevent headache attacks. And they can be non-invasive, which is preferable, where it's portable and a person can use the particular device without having to go through surgery. And rarely there are implantable neuromodulation devices, some of which are in development, none of which is FDA approved yet, for a more difficult to treat headache disorders. So the idea here is that in the setting of medications, you're targeting various chemicals that we know about. But with neuromodulation, you're activating nerves, and those nerves are controlling targets that we know about, targets that we don't know about. They're targeting the whole spectrum of potential reasons that people have headache within the brain. So it's very attractive. And the non-invasive neuromodulation devices, every single one of them, which is FDA cleared, is a non-significant risk device, which means no significant side effects. And when one looks at the risk-benefit analysis of a device that doesn't have significant side effects and that may provide relief, and which targets the entire system and not a particular chemical, becomes a pretty attractive prospect.
That was a great description. Can you tell me, when someone's having a migraine attack, do they have more electrical activity in their brain or a different kind? What exactly is going on up there?
It's very complicated. It's not
Like everything with migraine.
yeah, not a straightforward.
Sorry, it's everybody I talk to is like, it's very complicated. We know. Okay. Go
Yeah,
ahead.
it's not a straightforward answer that you have more electrical activity or less. There was a study, a fantastic study that Arna Mai published in the journal Brain, of one brave woman who agreed to have functional MRI done every single day at 10 a.m. for a month without any treatment for her migraines. And she had 3 migraines during that month. And the MRIs, the functional imaging, was able to show each of the 3 migraines looked the same, but the relationship between different parts of the brain changed in a reproducible manner slowly increasing certain kinds of relationships between certain parts of the brain as she approached the attack, and then certain areas of the brain activated and other areas went actually silent during the attack. And then between the attack, she would revert to a resting state, which would gradually change again as she approached the next attack. So I think that it's the what's called the connectivity. It's the relationship between different parts of the brain that change across time during migraine. And some of those areas of the brain appear to be generators for migraine, and some appear to be places where migraine is altered or processed, and some are pain pathways, and some pathways you want to inhibit and turn off pain pathways, and other areas you want to increase because they decrease pain. So that is why I say it's complicated. And what the devices do is they try to use primarily inhibitory stimulation to try to down-regulate what's going on.
Okay. So do any of the migraine medications that are currently on the market affect neuromodulation, or are they only working on the chemistry?
Well, they only work on chemistry, but in working on chemistry, they change the pain regulatory systems of the brain. And they do it very dramatically, as long as the particular person has headaches that are related to that particular chemical. For example, CGRP, calcitonin gene-related peptide. The majority of people who go on medications that prevent CGRP activity get better. But there's a percentage of patients who don't, and I think of them as not having a CGRP biology to their migraine. But what happens with CGRP medicines is that by targeting CGRP or the CGRP receptor outside the brain, in the coverings of the brain, they inhibit pathways that go into the brain and activate the migraine. And in doing that, they have some similarity to neuromodulation, because in neuromodulation, you're starting outside the brain and you're trying to inhibit central brain pathways that lead to headache.
Great. So the new devices that are available are only available by prescription. They're not something you can buy on Amazon. So how can
Not
someone who...
true.
Oh, not true. Okay, tell
No
us
longer,
what's
no
available. Okay, tell us what's available then.
Tell you what's available. Okay.
Yeah.
Well, the easiest way to think about this is that there are 5 FDA cleared non-invasive devices, of which 2 are not commercially available, which leaves 3 that are available, 2 of which require a prescription, and 1 of which, as of October, the FDA said is so safe and so established that it no longer requires a prescription. And some of these are getting a little bit long in the tooth. That we've had a lot of these devices for 8 to 10 years, so they're not all new. And I can go through them with you if you wish. Okay.
Yeah.
The oldest device is called the Cephaly device. It has various generic terms. It's sometimes called an external trigeminal neurostimulator. And it has had a few other terms for it, but everybody calls it the Cephaly device. And the Cephaly device is the one device which no longer requires a prescription. So anybody who wants to try the Cephaly device can go online and order it. And the Cephaly device, first of all, to describe it, it's a silver device. There's a sticky electrode that person puts on the forehead, and then the device attaches to that with a magnet. It's been pre-charged, and it has 2 programs. One program, the prevent program, is to prevent migraine, and it is turned on with 2 pushes of the button, and a stimulation goes through the supraorbital and supratrochlear nerves of the forehead, which is part of the first division of the trigeminal nerve. And the signal goes into the brain, and the prevent program stays on for 20 minutes and then turns off. And we recommend that people do that in the evening because it has a relaxing effect once people get used to it. And so the dose is 20 minutes nightly or in the evening or daily if somebody prefers to do it in the morning. And over 3 months, a significant percentage of people who were studied with cephaly had at least a 50% reduction in their migraine days. The acute setting for cephaly is you put it on the same way, press the button once, and it turns on a different program which stays on for an hour and brings a bad migraine intensity down. And recent data suggests that one can repeat that and do it 2 hours if one doesn't get satisfactory relief. I always tell my patients that the longer they use it and the more the prevent program works, the better the acute program works, because when the foot's off the accelerator, the brake works better. And to access cephaly, the cost, the usual cost is $550 one time, although there are frequently deals on it that take that amount and lower it. The initial expenditure is for the device and for 3 of the sticky electrodes, which, if babied, each electrode lasts 1 month. And then every 3 months, the person has to replace the electrodes, which costs $25. There is also currently available on the website a program which allows a monthly payment for the device, much lower payment. So a person doesn't have to necessarily pay the entire amount, whether that be $450 or $550 at once. One can stagger the payments. But I tell people that it really, in the prevent program, it really takes 3 months to know if it's going to be beneficial. That's the cephaly device. The next device that is available is called the gamma-core device. And the gamma-core device is also called a non-invasive vagal nerve stimulator. That device looks like an old Norelco razor. It has 2 metal round knobs at the top, and a person has to put gel on the 2 knobs and then put the device over the vagus nerve. And when it turns on, it activates an inhibitory pathway in the vagus nerve, and the side of the lip will twitch on that side. That's how you know that it's on. And this device is approved for a number of uses, and it is each stimulation is for 2 minutes. And hang on one second. Oh, there we go. Each stimulation is for 2 minutes, and then there are multiple stimulations. So sometimes I'll go through each one. The device is approved for the acute treatment of migraine. And in that setting, what happens is a person will do 2 2-minute stimulations at the beginning of a migraine or during a migraine to try to bring the migraine down, and then wait a period of time. And if necessary, do 2 more stimulations and then wait a period of time and then do 2 more stimulations to see if it'll bring the migraine down. So maximum of 3 2-minute stimulations, although repeat stimulations can be done. It's also approved for the preventive treatment of migraine. And the preventive treatment of migraine are, again, 2 2-minute stimulations, but 3 times a day, every day, to prevent migraine. And then person could still use it for the acute treatment on the side. And the gamma-core device is also approved for the acute treatment of episodic cluster headache. And this is only episodic cluster, not chronic cluster. So what that means is that a person would have to have periods of time with no cluster. That means currently for the diagnosis of episodic cluster headache, person has to have at least 3 months of no cluster during the year. And it didn't really work for chronic cluster, for people that have cluster every day and never get a day off. We don't really know why that's the case, but that is the case. So it, again, is a certain number of stimulations for the treatment of episodic cluster headache attacks. And it's also approved as an add-on for the prevention of cluster. And this is for all cluster, not just episodic cluster, but also chronic cluster. So people would do multiple stimulations per day, every day, to prevent the cluster, and then they can treat on an as-needed basis on top of that. So it's quite a flexible device that's been extensively studied. Interestingly, they got an emergency use approval from the FDA for this device for the treatment of bad asthma and difficulty with breathing in the setting of COVID. And it's also, it's being studied in COVID, but it's also being used in COVID because the device can help asthma and bronchospasm. So it's being studied in a number of other areas besides headache. The problem with the gammaCore device is the cost. And currently the cost of the gammaCore device is $575 a month. $575 a month. Let me state that again. For unlimited stimulation for acute or preventive use. And there's no commercial insurance that will pay for it. There's no commercial insurance, by the way, that'll pay for the Cephally device or for any of these devices at this point. There's a little bit of breakthrough in one of them, which I'll talk about in a second. The good news on the gammaCore device is that it is approved by the VA and by the Department of Defense. And my first question to patients is, are you a veteran? And the VA is really set up to get this device out to their veterans who have primary headache disorders. They have a whole electronic system set up. They have nurses set up that will get the device to patients. It's really, really good news on that, for that group of patients. It's terrible news for the rest of the patients where there's really not good commercial access and almost nobody can afford it.
And
so
if someone was interested and could afford that device, they would still go through their doctor to get a prescription, correct?
Have to have a prescription, okay. And then it has to be shipped to them. Each of these devices gets shipped to the patient. None of them is available at a drugstore. Okay, so that's the gammaCore device. The third device that is FDA cleared is the Neurivio device. And the Neurivio device is called a remote electrical neuromodulation device. This device is only cleared, and I always say FDA approved, but it's actually, each of these devices has a slightly different designation than medicines. And they are FDA cleared, but not FDA approved in the same way that medicines are. I think it's a difference without a distinction, frankly. But the Neurivio device is FDA cleared for acute treatment of migraine only. And this device is an oval-shaped device, which is put on the arm with an armband, and it can actually be put underneath clothes. And it's turned on with an app on a smartphone. And when it is turned on, it activates for 45 minutes to turn off a migraine. And as with Cephally, it appears to work better if somebody treats a migraine early. But it's very effective. Real world data have been published on the Neurivio device from patients who uploaded their information, and thousands of patients are using this device for over thousands and thousands of attacks and not requiring medication as long as they treat early. The way this device works is that it activates a reflex that goes up to the brainstem and comes down and inhibits the migraine. And I won't go into the detail of the reflex, but it's called conditioned pain modulation, a very specific mechanism for inhibiting the migraine. Now, the good news, as opposed to gammaCore, the good news on the Neurivio device is everybody is eligible to try it for $10. And each device contains enough juice to be used to treat 12 times. And that should give you a pretty good idea whether it works or not. The bad news is that once you've paid your $10, if you have Medicare or Medicaid or a government insurance, then it's not eligible for coverage unless, I think the VA still covers it, but most of the Medicare and Medicaid programs, none of them cover it. And then the cost is $99 for 12 treatments. But there is a movement on this device for getting commercial coverage. So we are actually submitting our patients to insurance companies, and sometimes the insurance companies pay for the Neurivio device. So that's a very attractive device for the acute treatment of migraine. And again, no significant risk to its use. Now, there are two other devices that are FDA cleared, one of which is the single pulse transcranial magnetic stimulator, which used to be called STMS, and at one point it was called Spring TMS. And this is a device that goes on the back of the head and pulses a magnet. And it was FDA cleared for both the acute treatment of migraine and the preventive treatment of migraine with different programs. The preventive treatment, if I recall, was 4 pulses twice a day. And the acute treatment was one could do 2 to 4 pulses and gradually and repeat up to 17 pulses in a day. The problem is the company went bankrupt in the fall of 2020. And the hope is that there will be an investor group that will restart this and make this very useful device available again. But as of the time that we are talking, which is January of 2021, it is not currently available. The other FDA cleared device is called Caloric Vestibular Stimulator, which is made by a company called Scion. And that device is FDA approved for the prevention of migraine. It's a headphone that people put on that heats and cools the nerves going in through the ear and prevents migraine very nicely. For whatever reason, the company decided, even though they had the FDA clearance, that they were not going to commercialize it because they're going to use the device for Parkinson's as well. And so we don't know if it'll ever see the light of day for migraine prevention. It was not studied for the acute treatment of migraine. Okay. And then there are multiple devices that are in various stages of development, some of which are very close to FDA, or either are in the stage where the FDA is considering approval or are just about to get to that stage. So 2021, we might have FDA clearance for further devices, which I'm glad to tell you about. But
great. Well, let's hold that. And just so people know, there is a cat at the edge of the frame. So if you're seeing a few little whiskers or something, that's what's going on. So this series is about people who are trying to build their resilience, right? People who have chronic conditions, chronic illness, and that's the encouragement, is ways to feel more resilient. How can a tool like one of these devices build resilience, in your opinion?
Oh, I think it's wonderful for that. I mean, these are empowering devices because of the absence of side effects and the liberation from the need to use medications. So they are very helpful for people who want to carry on their activities of daily living, who want to um, manage migraine or cluster in the case of the gamma core device, and not let their headaches manage them. And also the locus of control is with the person who has these. You know, you don't have to go to a doctor and get a shot or an injection or anything like that, or an infusion. You have this opportunity to treat. And also they work by different mechanisms. So I have some patients who use both Cephally and Nerivio. They use Cephally preventively and they use Nerivio for as needed treatment. So they are, we consider them part and parcel of our treatment. The day doesn't go by where I don't recommend one of these for people. I use them, as I said, and people that have had so many medicines not work. The medicines don't seem to be effective for those particular types of headaches. People who don't tolerate medicine, people who don't want medicine, people who don't want to be tied to medicine. And I don't even technically need to follow up with the people because these devices are so safe. They can go out and use them. And if they want to consult with me, they can consult with me. But I don't have to check their bloods. I don't have to, they're not tied to me. They're liberated from me. And again, what I would say about this is it was those people who, those providers who disparage these devices and these payers who inexcusably don't pay for these devices, the risk benefit on these devices is in favor of the devices. They are non-significant risk. They have significant benefit seen in randomized controlled, sham controlled trials. And why would these not be covered? Why would providers not want to give these, make these available for their patients? I mean, these are really, really, really helpful options for people who want to achieve resilience, independence, and improve quality of life.
That's great. And that seems like it's a place for advocacy for people who are listening to get involved to try to get insurance to cover. So if you're saying you're nodding along and saying, yeah, why aren't they covered? That might be your calling to try to get out there and work with some of these organizations that are working on that. My final question for you is I ask everybody, what are some of your personal self-care resilience strategies to take care of yourself? You're a busy doctor. We're going through a stressful pandemic. Tell us about your self-care resilience strategies.
I use exercise. I mean, I try to exercise daily or as close to daily as I can. I also like periods where I can get out of the house, and I live half time on Cape Cod, so I try to walk the beach every day, and with my wife and my dog, and I think that's a very helpful strategy. So I have kind of a meditative walk, and then I also, on top of that, try to do regular aerobic exercise. I also do regular sleep. I have regular sleep habits as well. Those are my three strategies.
Excellent. Dr. Tepper, thank you again for being here today and sharing your research and your knowledge with us. Check out other episodes of the Resilience series on Facebook Watch, IGTV, and YouTube. And follow me at SWeaverMPH on all social media platforms to learn more about my upcoming book, The Migraine Relief Plan Cookbook, which is due out in spring 2022 from Surrey Books. Thanks for watching.